Good morning, everybody. Please settle down. The Subcommittee on Finance will now be tackling the budget of the Department of Health for this morning. So I guess we have to start the ball rolling. And before that, the chair would like to acknowledge the presence of my co-chair, Senator Risa Otiveros. Thank you, ma'am, for being with us. So to start the ball rolling, I'd like to ask the committee secretary to acknowledge the resource persons present for today's hearing.
Good morning, everyone. The committee would like to acknowledge the presence of the following resource person. From the Dr. Francisco Duque, the Secretary of the DOH, Dr. Rolando Enrique, Health Regulation Team, Dr. Mario Villaverde, Health Policy and System Development Team, Dr. Roger Tungan, Administrative and Finance Cluster, Undersecretary of Health, Dr. Roy Ferrer, the Philippine Health Insurance Corporation, Dr. Annabel P. de Guzman, Philippine Institute of Traditional and Alternative Healthcare, Ms. Nella Charade Puno, Director General, Food and Drug Administration, Dr. Vincent Balanag, Executive Director, Lung Center of the Philippines, Ms. Myra Cabotaje, USEC Public Health Service Team, Mirna, Mr. Ruben Jean Basa, PhilHealth. Did I miss anybody? Okay, that would be all, Mr. Chair. Thank you.
Thank you, our committee secretary. So to start, the chair would like to give the floor to our Secretary of Health, Secretary Francisco Duque.
Thank you very much, Mr. Chairman and Honorable Senators Ejercito and Ontiveros. In behalf of the Department of Health, it is indeed my pleasure to have the opportunity to present the Department of Health budget highlights. And may I have the first slide, please? The 2019 proposed DOH budget is based on the DOH utilization and the DOH budget obligation. On your slide, as you can see on the screen, in 2017 was relatively high at 95%, but was only able to disburse 57 billion or equivalent to 62% of the allotted funds. Majority of unspent budget are for multi-year projects such as infrastructure development. Also, as you can see on the screen, compared to 2017, 2016 disbursement was 3% higher at 65% of the total 71 billion allotment versus the 93 billion allotment for 2017. Beginning 2014, the DOH budget has increased significantly with the sin tax law. The 2019 budget has been adjusted to the government's shift to cash-based programming with a total proposal of 141.85 billion pesos. The 2019 National Expenditure Program is as follows. 70.12 billion pesos or 49% is for the DOH proper, while 920 million pesos or 0.64% goes to attached agencies, and the rest, 70.81 billion pesos or 49.92% is for attached corporations. Take note, though, that PhilHealth gets the lion's share of the proposed NEP next to the DOH proper. Approximately 54% of the 2019 National Expenditure Program will be for the personnel services due to the implementation of the 2015 Salary Standardization Law of 2015 and Tranche 4 rates. Maintenance and other operating expenses is at 45%, and capital outlay will just be 1% for the total budget. The bulk of the budget for the DOH proper is for operations, specifically to ensure access to curative and rehabilitative healthcare services at 46% of the total proposed budget, followed by access to promotive and preventive healthcare services at 30% of the total proposed budget, as you can see on the screen. Next. The major activities are based on the health commitments in the Philippine Development Plan and the budget priorities framework. The 3.43 billion is proposed for the Public Health Management Fund to implement integrated public health programs, while the 7.55 billion pesos is for the National Immunization Program, specifically to provide vaccines for infants, adolescents, pregnant women, and senior citizens. For family health, nutrition, and responsible parenting, 2.47 billion pesos is allocated for micronutrient supplementation to vulnerable population and family planning commodities to poor women of reproductive age. Next, to provide diagnostic, prevention, control, treatment, 738 million pesos will be for commodities to address infectious diseases such as sexually transmitted diseases, HIV/AIDS vector-borne diseases, food and waterborne diseases, and emerging and re-emerging diseases. 880 million pesos will also provide for diagnostic, prevention, control, and treatment commodities for tuberculosis control, and about 220 million pesos is for the provision of diagnostic, prevention, control, treatment commodities to address diseases for the elimination of malaria, filariasis, schistosomiasis, and leprosy. Now, next slide. 1 billion pesos is proposed for human resources for health deployment to strengthen the capacity of the primary healthcare workforce and to support national and local health systems through the deployment of doctors and the provision of scholarship grants for medical courses such as medicine, nursing, and midwifery. While 50 million pesos for health facilities enhancement program will be used to monitor projects funded in 2018, 2017, and in fact even the previous years to ensure project completion, functionality, and PhilHealth accreditation, and 67 billion pesos will be for the subsidy to the insurance coverage of 15.44 million national household targeting system for poverty reduction, or more commonly referred to as the NHTS poverty reduction families. Also, this will be used for about 5.4 million senior citizens and about 46,000 families in conflict areas. So the total proposed budget for major activities for health for 2019 is 85.94 billion pesos. So, Mr. Chairman and Your Honors, this is, in a nutshell, the budget highlights of the Department of Health. Thank you, Mr. Chairman.
Thank you, Secretary Duque. Before I would like to ask questions, Senator Tiberos might have some concerns, but just very clearly, with the indulgence of my colleague, I'm just worried about the budget of the Health Facilities Enhancement Program, or the HFEP. There's a big, very big cut from 2016, 26.8 billion, 2017, 24.19 billion, and 2018, almost 30.3 billion was allotted for HFEP, but for 2019, it's only 50 million. And I am a witness on, I've been going around the provinces and I try to check on the health facilities, provincial hospital, regional hospitals or DOH-run hospitals. And I'm a witness that this HFEP is really a big help in improving the health facilities, especially the different government hospitals, especially those, sometimes the provincial and the city hospitals, which, considering that they do not have really that much fund, but the HFEP from the central government is a big help in improving the health facilities. So, what will, I would like to ask probably Secretary Duque or anybody can answer, how will they, I'm sure this will really affect, no, our program on improving improving the health facilities. But how will you be able to cope up? Let's say if really 50 million is really is the budget approved by the DBM, considering it came from 30.3 billion.
Thank you, Mr. Chairman. The 50 million is earmarked for the technical capacity of the DOH. It's not really for HFEP. It's really to monitor the infra projects of the DOH, which over several years many of which have not been completed. And that's why Secretary Ben Diokno has in fact told us in our presentation to him the 2019 DOH proposed budget. He articulated that about 84 billion pesos worth of infra projects have not been completed. And so he was saying that perhaps 2019 should be a time for a catch-up activities. Catch-up plan was submitted to them, and 2020 more or less will there will be a resumption of the usual higher budget allocation for the HFEP project.
So that was the rationale. So the 2019 is supposed to be a catch-up year for all the projects, all the delayed projects probably to catch up for 2019. But my worry, Secretary Duque, is that I saw some, for example, the one in Apayao province, no? You know, these provinces are far-flung areas, and they really do not, any help from the national government will be very, very vital. They have a 100-bed capacity, and through the HFEP, they were able to build a structure to increase bed capacity to about 200. The structure is about probably 20-30% completed, but if 2019 there is no, they cannot be allotted to another certain amount, no, to complete the facilities. Parang sayang naman ho yung sinimulan. We will have projects that are halfway through or uncompleted because of the HFEP. Hindi mo makukumpleto. No, yeah. So what would the DBM, how would they treat circumstances such as these? Well,
Mr. Chairman, in the catch-up plan that we have submitted, there will be a 16 billion pesos supplemental budget that we have proposed, and the catch-up plan will consist of prioritization of the existing HFEP projects of the DOH based on the following. Priority 1 will be for equipment requirement for the 100% completed infrastructure. Priority 2 will be those 90% completed infrastructure, but will need additional funding for completion to enable the facility to deliver better services. And good morning, the Honorable
Before continue, Secretary Duque, the Chair would like to acknowledge the presence of our Minority Leader because he has some concerns that I will propound later. Please continue. We are already talking about the catch-up plan of the HFEP for 2019.
Yeah, so the priority 3 infra projects are 80% completed infrastructure, but will need additional funding for completion to enable the facility to deliver better services. And lastly, priority 4 will be infra projects which are 70% completed, but will need also additional funding for completion to enable the facility to again deliver better services. And these are mostly infra projects with phased implementation. So this largely explains the 16 billion that we have proposed budget as a supplemental budget. Yes, Mr. Chairman.
So in case it will the catch-up plan materializes, then the 16 billion is on standby for use of those projects that are already about to be completed.
For 2019.
For 2019.
Yes, Mr.
Yeah,
Chairman.
because one example also, aside from Apayao, Secretary Duque, because I'm concerned because I mean, these far-flung areas, it's not often that they will be able, they get the chance to be able to get some funding, no, to improve their facilities. And likewise in Iloilo, in the home province of our minority leader, the West Visayas Medical Center in Western Visayas, you're able to allot some funds for its upgrade and improvement through the HFEP. So I'm hoping that it will not be affected because, you know, Iloilo is already one of the more progressive and more urbanized. So these two facilities, they really need upgrading at this time. So what is the another question is what is the utilization of HFEP, which is why probably one of the reasons why the DBM, as usual, cuts the budget if they don't see very good utilization of the HFEP. But really, I would again reiterate that the Health Facilities Enhancement Program is a very big help, no, to most of the provincial and regional hospitals. Yes, before you continue, Sec Duque, the chair also would like to acknowledge the presence of Senator Nancy Binay. Thank you for joining us.
Mr. Chairman, I understand that the utilization rate can be measured via two ways. It's the obligation rate, which is the amount obligated over the amount appropriated or allotted, while the other metric is also the disbursement rate, which is the amount of actual monies disbursed over the allotment or appropriation. And considering that a lot of these infra projects are multi-year implemented projects, the obligation may be high as a metric, and that we have more or less have here for 2016. The obligation rate was 68%, while the disbursement was low at 34%. And for 2017, the obligation rate did increase or improve tremendously to 95%. But, however, again, the disbursement rate is very low at 12%. And, of course, in 2018, as of first semester, the obligation rate is only 31%, and the disbursement rate is at 7%. Largely for the following reasons. Again, number one, the projects, depending on the complexity of the building program, if the building program calls for, say, a huge level 3 hospital, obviously you cannot finish that in 1 year. It will take, in fact, about 24 months to about 36 months at the most, assuming that there is efficiency in the way the construction is undertaken. But
Mr. Chair, can I just interject at this point? Presently, which is still on an obligation budget, when you build a hospital, for example, you don't budget for the entire building, for the entire project. Is that correct? You only budget for what can be obligated. You have a multi-year budget process. In other words, if just theoretically, if it costs 500 million, you can budget this year 100 million, and then another 100. And your performance is judged not on your utilization of the 500, but on utilization of the 100. Using that standard, how do you explain the very low utilization rate of your budget? And that is why the DBM was very harsh on you.
Essentially, Mr. Chairman, I agree with you that the programming of the certain infra projects has to be in such a way that, for example, a building will take 36 months to complete. So in first year, you have 12 months, so there should be 2 phases of completed deliverables, not the entire building.
Yes.
And our metric or our performance ought to be based precisely on that point.
Precisely.
Yes, exactly.
Yes.
So, which DBM does not seem to see?
I don't think so. Is there a DBM representative here? Is it not a matter of, okay, can you, because this is really a very serious concern. I have not seen a budget in my 20 years in the Senate which is slashed this much, and budget of the DOH at that. So there must be some explanation here. I cannot imagine that the budget for, okay, here, health facilities enhancement program, from 30.26 billion in 2018 to 50 million. I mean, this is something really unusual. That's why I'm alarmed, and that's why I asked the chairman to allow me an opportunity to intervene, because this is something worrisome. May I know what is the reason for this from the budget people, if we may ask? Can we have the...
From DBM Director, can you
explain
can
this
you
to us?
explain the concern of our minority leader?
Magandang umaga po, sir. Ako po si Jane Abella po ng DBM. Yung reason ho natin kaya ho natin lang naibigay yung 50 million is kasi ho, if we consider the performance ho ng DOH under the HPEP, hindi ho talaga maganda ho yung kanyang mga utilization. So,
Example, that's a conclusion. But can you give us the facts and the figures
Sir, kasi ho, yung 2019 ho natin was based on the 2017 performance po. So, if we look at the performance po of DOH under HPEP, ang kanyang hong ang obligation ho kasi is 95%. Kasi ho, pwede naman ho talagang i-award, di ba ho?
What year?
Yung
What
2017.
specific? Okay, 2017,
Opo.
what happened?
Ang obligation ho kasi, pwede ho talagang i-award yan.
Yes,
Ang
yes.
pinag-uusapan po natin, sir, kasi yung talagang hong na-complete or na-deliver na natin. So,
Well, because even on an obligation basis, I'm looking at 2018. 2018 on the entire budget, huh?
Opo.
The entire budget for 2018 was, let's say, 107.3 billion. The obligation was only 39.2 billion as of June 30. Huh? So even on an obligation basis, it is still very low. So I cannot understand this. So I want it, okay, on a yearly basis. In 2017, what happened? What was the total budget of DPWH and just first on the health facilities enhancement program? What happened in terms of the obligation and in terms of disbursement?
sir, yun nga ho, yung minention ko kanina, yung 2017 ho na obligation is 95% for the HPEP only po. Pero when it comes to the disbursement po, yun mismo talagang ho meron na ho natapos, 12% lang po ang kanilang utilization sa disbursement
Miss
po.
DBM, pwede ho ba i-specify natin, all right, in 2017, how much is the budget? How much was the budget for health facilities? How much? 2017.
Sir, per our record, sir, for the DOH alone, no,
Yeah.
it's 113
How much?
113 billion po yung kanyang appropriation for the 2017. Ay,
Okay.
Yung sa HFEP lang, ma'am. Yun po yung
HFEP lang,
tinatanong
sir.
ni Minority Leader.
Because here we focus first on the health facilities program. It went down from 2018 present budget 30.267 billion. 2019 50 million. I have never seen this kind of a drop unless you're telling me that all these projects have been completed or all these equipments have been purchased and there are no equipments to be purchased. What is this?
sir, yung,
Oh,
balikan ko lang
gusto
po
lang
yung
po namin
2018.
maliwanagan
Opo.
before we discuss all the substance.
For 2018 po, ang HPEP po nating allocation is 30 billion po. 30 billion 270 million.
That's correct,
Opo.
30 billion.
Pero pagdating po sa obligation ho,
Okay.
ang na-obligate pa lang ho nila of the 30 billion is only 9.2 billion, which is only 30.60% lang po yan.
30,
0.60% pa lang ho.
okay.
Pero ho
There's
sa
a point.
pagdating po sa disbursement, ang na-disburse pa lang ho nila is 6.80%.
26% ang obligation.
This,
2018 po, ma'am.
How much in pesos ang na-disburse?
It's only 2 billion 44 million 87,000.
Or 6 point, okay.
6.80% lang po, sir. For
Just
of
for the record,
2018,
does health in facilities enhancement program include both infrastructure and equipment? Is that capital outlay lahat ito?
Yes, Your Honor. Equipment and infrastructure.
Equipment and infrastructure.
Yes, Your Honor.
You know, when I saw this, I thought that they were going to transfer infrastructure to DPWH. Hindi.
Hindi naman ho.
So sa inyo pa rin.
Sa amin pa rin
So
ho.
talaga pong binawasan ng husto.
Binawasan ng husto.
Yan ang ibig kong malaman. What happens now? Okay. We are not building any hospital. We are not buying any equipment next year for the Department of Health.
Mr. Chairman,
Yes, please.
if I may, the conversation I had with Secretary Jokno is that he said 2019 should be a year of catch-up because of many unfinished infra projects, and he said that hiningi niya sa akin, ang sa akin ho naman, sinabi ko I will need about 16 billion pesos supplemental budget for 2019, and based on the prioritization that we have scheduled. So priority 1, yung pong sinabi nyo, 100% completed yung project, wala lang equipment. So kailangan lagyan ng equipment para gumana. Yung priority 2, 90% completed project, we need additional budget to complete it and make it operational. And then priority 3 will be 80% completed, and priority 4, 70% completed. All told, that will be around 16 billion supplemental budget required for 2019, Mr. Chairman. And then 2020
You know,
po.
as you would know, a supplemental budget has a technical meaning. Supplemental budget means there are funds available, and the National Treasury certifies that there are funds available after the budget is finished, is signed and executed, and therefore we have a supplemental budget. You're saying that you need 16 billion. But at this stage, why are we already talking about the supplemental budget when we are still crafting the 2019 budget? I cannot understand that. I cannot understand why, when we are crafting a budget for 2017, this early, we already are talking about the supplemental budget. We are saying that in 2019, we need 16 billion pesos more. Is that correct?
That's right, based
Just
on our
on the health
conversation.
facilities.
Yes, sir.
what prevents us from allocating already 16 billion today and make it part of the national expenditure program rather than a supplemental budget? Why? Madam, yes, Director from the DBM.
Even nga po yung performance ng DOH under HPEP, and ayon ho doon sa pinag-discussion po ni Secretary Duque and Secretary Jokno, kailangan na lang ho talaga, ang sabi ho kasi during the meeting, sir, if I'm right, ang pinag-usapan ho is DOH has to make a careful assessment of the program. Kaya ho, kasi ho marami ho silang backlogs eh.
Yeah, but, so this is a punishment on DOH?
No naman, sir.
Ano pang ibig sabihin nun? Kailangan na pakita nyo ng DOH, show to the DBM that you can perform and we will give you the funds. If you cannot perform, bahala na si Batman maggamot doon sa mga nangangailangan ng gamot. Ganun po ba yun? Hindi naman. Hindi naman.
Hindi naman po, sir. Kaya lang talaga ho, kasi pag binigyan pa ho natin, kung bibigyan po natin kasi siya ng additional na pondo, parang magpa-pile up ho kasi yung mga dapat niya pa hong gagawin. So, ang ano lang naman ho, sir, ang sinasabi naman ho lang ng
ano kung magpa-pile up, hindi nyo man release ang pera. Basta, budget is only an authority. If they do not perform, do not use the authority, do not release the funds. But for us to say, we will not budget anything, is wrong. You have full control of the budget. I repeat, the budget is only an authority to spend. If this lousy secretary, in your view, does not perform in accordance with what you expect, you withhold the releases. Because that is only an authority. But why are we already saying at this stage, we will not give you any authority by making your budget only 50 million? I do not understand that. Really, this is the first time I'm hearing it. Any department, I'm not referring only to the Department of Health, when in the judgment of the DBM does not perform, withhold increases. I'm sorry, withhold releases. At the end of the year, since we will be looking at our cash position, we determine our deficit on the basis of what was disbursed. Yes,
Sir, mag-follow up lang ho ako, sir. Kasi during the time na ginagawa ho namin yung budget ng 2019, we were asking DOH for the details of the 30, I cannot recall magkano ho yung kanilang yung hinihinging proposal for 2019. At the time ho kasi, they cannot give us the details of the amount they were proposing in 2019.
now
Sa rin ho yun kasi, sir, nagiging reason, kaya hindi rin ho kami
now do you have the
makapagbigay ng
details,
support.
Secretary Duque?
Chairman, we do have the details.
Oh,
and,
now that
we
they
can-
have the details.
Now, sir,
Only
hindi
now,
ginagawa ho
sige,
yung
but this
budget,
budget-
wala ho eh.
Only now that they have the details. But the budget has not yet been finished. That is why you are here before us. Now they are going to submit to you the details, which you said, yan kasi hindi nyo binigay sa amin yung detalye eh. Kaya we will punish you. We will give you only 50 million. Now, so Secretary Duque says, I need a supplemental budget, which to me is out of place because we're still talking about a budget for 2019. Now he has the details. Are you willing to consider, coming from the DBM, a readjustment of the Health Facilities Enhancement Program?
I think, sir, I have to raise it with my principals. Although, sir, sinabi ho nga ni Secretary Duque, the DBM, based on discussion with Secretary Jokno, will intend to sir, it would be a supplemental budget, sir.
Or a catch-up
Mr. Chair.
plan,
No, no.
For the catch-up
This
plan.
is the first time that a supplemental budget is being proposed to us during the budget season and before the budget is even approved. How can that be? Oh, so now, Mr. Chairman, because this pattern will follow in the other programs of the Department of Health. You talk about human resources, the health human resources. You reduce the budget from 2018 of 9.5 599 billion, 9.6 billion to 1.7. This will result in displacement of nurses. Are we saying that we'll have a supplemental budget? By the time we pass the supplemental budget, you have thousands of nurses on the streets and patients who are looking for services. Yes, ano.
Sir, it was not reduced, sir. We transferred around 7.8 billion to the miscellaneous personal benefits fund.
Why?
In case ho na magkakaroon ho ng conversion from job order to contractual na po. Yun hong nasa MPBF, may increase, depende ho kasi kung ano yung talagang mako-convert natin from the job order to contractual ho. It's just a floor ho, yung binigay
Why
natin,
can we not do it
transfer
now?
po natin.
Why can we not do it now and include it in the regular budget? Why do you place it in the MBPF and let the Department of Health plead with Malacanang to release funds from the MBPF?
Kasi sir, i-evaluate pa po natin yun, sir. Kung ano yung, i-evaluate pa po natin, sir, kung ano yung i-convert.
Why can you not evaluate it now? Isn't that the purpose of a budget for 2019? You evaluate the needs today for authorization in 2019. Correct or not?
Yes, sir. Kaya lang nga ho, sir, it will take some time ho bago ho matapos yung evaluation ho natin. So, it would be more, kung mailalagay lang ho muna natin sa MPBF. Kasi once ho na-determine na ho talaga, ma-evaluate at ma-determine na ho yung mga number, pwede naman ho natin siya. By 2020 ho, mai-in place na ho siya sa budget ng DOH.
Maganda po yan, in theory. But pumunta po kayo sa probinsya, daang-daang nurse matatanggal by the end of this year. Huh?
About 15,000,
18,000.
Yeah, 15,000,
15,000.
Your Honor.
15,000.
Yes, human resource for health in our deployment program to the LGU facilities.
Yes. But 15,000 will be on the streets while we are evaluating. So, I know that what did the system come from? Why do we have to do this? I will repeat, this budget would only be authorizations. If the DOH, or for that matter, any other agency, does not perform in accordance with your standards, do not release the funds. As simple as that. Rather than go back to us, Congress, alam mo naman kami mga politiko, ang daming tinatanong, by the time we finish the supplemental budget, patayin na yung kabayo. Hindi po ba? Yes.
Actually, sir, according to the unit in our department that crafted ho the circular, ang CSC ho, COA and DBM, they will be revisiting the circular ho, and they may come up with a circular before the year ends po.
With a circular?
With the joint circular
Can a
ho.
circular appropriate funds?
No, sir. On the issue of the job orders.
Of the?
Job orders po, sir. Kasi naapektuhan po siya ng circular joint circular na na-issue ho ng
So why can we not do it now? Why?
Sir, the review and the revisiting is already ongoing. And the revised circular may be issued before the year ends po.
Kaya nga, before the year ends, December 30, 2018, before the year ends, in 2 days' time, January 1, 2019, you have thousands of nurses on the streets. Ano ba naman, what kind of planning is this? As I will repeat, like a broken record, you are only looking for standby authority through the budget. If they cannot hire the nurses, the funds are not released. But why are we already saying you have no authority to increase your budget until we finish our circular? That is not simply acceptable to us. Maybe, you know, I'm in the old school where I have learned that budgeting is a matter of authorization. Even the deficit, you would control DBM because you will not release if the deficit is going out of hand. But to deny authorization and come back to us on a supplemental budget simply is not consistent with the health delivery service that we are looking for. So what do we do now, Mr. Chair?
Yes, with the indulgence of our minority leader, Senator Ontiveros has a concern.
Actually, Mr. Chair, in support of what the minority leader is pushing, yung isa pang problema kung ipauubaya yung HFEP sa isang supplemental budget, it will go through the same process we are going through now. Pero kung handa naman na yung DOH with the list that the DBM Secretary also asked for, yung catch-up list na yan, yung it's in a way a list of priorities, mayroon ng halaga, then as the minority leader is saying, but hindi natin isama na ngayon. And then dagdag, the point he was raising about the health human resources. So again, bakit ililipat sa MPBF subject to the decision-making powers of the DBM instead of under the DOH where it properly belongs bilang isang pillar ng universal healthcare system na sinusulong natin, Mr. Chair, under your leadership. So at the appropriate time, Mr. Chair, in support of what the minority leader has been pushing, I will move that we restore the HFEP budget based on the list submitted by the DOH. And secondly, Mr. Chair, at the proper time, I will also move or make a similar motion regarding the health human resources budget, Mr. Chair.
Thank you, Senator Ontiveros. Before the minority, with the indulgence of the minority leader, curious lang po, kung hindi po nangyari ito, Secretary Duque, maybe we know what's the proposed budget of HF for 2019? Kung hindi po na-slash, so that we will have an idea already.
About 30 billion.
So it's the same of 2018?
Yes, pretty much the same, Your Honor.
Mr. Chair, with your indulgence, you know, the proposal to increase the budget of the DOH as part of the committee report is well and good. But two things. Number one, it is the Senate now who will scramble to look for funds all over the budget. You know, budgeting is a zero-sum game. You get it, you give DOH this job to get it from somewhere. But more critical, if what you present in the budget is not consistent with the national expenditure program of DBM and the President, what do you think will happen? They will recommend an item veto because it is not consistent with their program. So they recommended an item veto, it becomes worse because you get it from some other item, places it in the Department of Health, that other item will suffer the cut of 60 billion or 30 billion, and yet it will not go to the Department of Health because it is vetoed. That is why, to me, the better alternative is for the DBM coming from the DBM to already recommend amendments to the DOH budget so that hindi na po ibibito. Kasi pag sinabi natin tayo ang magre-recommend at hindi payag ang DBM doon, ibibito rin eh. So, we're just kidding ourselves. I may suggest to Assistant Director Abella, ask your secretary to amend the National Expenditure Program vis-a-vis the Department of Health because that is the only decent thing to do. That is the most rational thing to do, rather than we in Congress restoring it and knowing the Department of Budget and Management. If it is not consistent with their policy, they'll have it vetoed. So we're back to the same concept that we are complaining about here. That is my suggestion, Mr. Chair. Not even an amendment coming from the Senate, but an amendment coming. There is an errata for the Department of Budget to submit an errata insofar as the DOH is concerned. How much that will be, that is a matter now that will be discussed by the DOH and DBM and submit an errata to the committee. Yeah, errato. Errata, no, that's a technical term when the budget is adjusted. When the budget for next year is adjusted in the debates on the National Expenditure Program, the submitted National Expenditure Program would be adjusted on the basis of the errata.
Chair?
That's a technical term. No, it's a plural and singular, so it depends on how many they're submitting.
Yes,
So
Senator.
that's my suggestion.
Yes, Senator Binay.
Secretary Duque, what were the reasons kung bakit ito mababa yung disbursement?
Unang-una, mababa ho yung disbursement. Sa pagkakaintindi ko po, yung kanilang metric na ginamit, yung dalawa kasi yung metrics ng budget utilization. One is obligation, were high in terms of obligation rate. But sa disbursement, mababa kami because the building programs vary from a very complex one to a very simple project like a barangay health station, which will probably finish between 3 and 6 months. Then pwede mong obligate, pwede mong disburse before the year ends. But now, you have a complex structure which will probably take between 24 to 36 months, no? Siyempre, yung disbursement mo, program mo yan dun sa progress na work na ginagawa. So, to me, ang position po namin dito ay sa planning stage, dapat alam mo na yung deliverables mo over the 36 months. So, first 6 months mo, phase 1. Ano dapat ang matatapos within the phase 1? And then, magkano ang binayaran namin? Our performance must be based on the deliverables within the first phase project. Magkano yung na-kompleto doon at magkano yung binayad namin. Hindi yung buong budget for that particular program kasi talagang lalabas ang amin disbursement rate napaka mababa. So dapat ipoprogram na ho natin, antimano. Kung 36 months yung project, first phase mo, 6 months. Second phase, another 6 months hanggang sa matapos. But in the first phase, dun mo kami susukatin ng DBM. Kung 20% sa first phase at nakapagbayad kami, say, kalahati lang, then 50% ng disbursement namin over the first phase, which is, say, depende kung ano yung project cost. I-divide mo lang. So, antimano sa planning stage, dapat ganun. Hindi mo, disbursement mo, ang metric mong gagamitin over the allotment. Hindi ganun. Dapat disbursement over phase 1 project cost. And then sa second phase project cost, magkano dinisburse namin? I'm sure tataas ang disbursement rate namin if we are to use the correct metric.
Mr. Chair, siguro, Secretary, kasi parang ang hirap na hindi namin nakikita yung actual project. Can you just submit to the committee?
We can. We already have the
of yung mga
Yes,
HREP projects. And then, ano na ba yung completion rate nyo? Ito ba 80%? Tapos, na-bid na ba to? Baka you can also
Yeah,
submit.
we can do that, Senator, Mr. Chairman. We already have the list of completed projects, first phase, priority 1 rather, needing only equipment. And then priority 2.
Yung Secretary, for example, kasi di ba parang ang reason ho ng DBM kaya hindi kayo binigyan ng pondo kasi mababa yung disbursement nyo. Can you submit to the committee yung, I think, 2018 projects nyo, or if you can submit din yung 2017 na hindi nyo pa din hanggang ngayon natatapos or tinatapos pa?
Yes, Mr. Chairman, we will do that immediately.
Thank you, Mr.
We
Chair.
already have the listing, Mr. Chairman.
Yes, our minority leaders.
Can I ask the DBM, what is the adverse effect of the disbursement not being in accordance with the standard that you set? I can understand that the performance of the agency in terms of assessment would be adverse now. But in terms of actual disadvantage to the public. Mayroon po ba? Hindi naman ninanakaw itong pera ito. Wala naman sinasabi ninanakaw. Mayroon lang very low disbursement, very low obligation. So, wala na. So, my first question is, siguro ang tanong, so what kung mababa ang disbursement? Alam mo, sa bureaucracia ngayon, I do not blame the bureaucracy for being extra careful because maya't maya, nasa ombudsman ka kaya kung ako ang direktor sa isang ahensya, mag-iingat ako. Wala namang akong kinikita rito. Kung bilisan ko, baka madapa pa ako. Ma-ombudsman ako. That's why nag-iingat din sila. So, in terms of adverse effects to, let's say, I know what, can you explain to us why that has to be, that it has to result in this, and a lower authorization to disburse or to spend? What is the adverse effects?
Sir, kasi pagka low disbursement, ibig sabihin po natin, sir, kasi noon, ibig sabihin yun ho yung nababayaran natin for projects or works completed ho. So, ibig sabihin ho, pag hindi ho mataas ang disbursement, marami ho tayo mga programa or projects na hindi ho na i-deliver sa ating mga constituent. Yun ho ang magiging consequence po.
Kaya nga, yan ang consequence at that reflects on the efficiency of the department, correct? And also on the service delivery. That's correct? But the remedy is, huwag mo nang bigyan ng pera. Tama po ba yun?
Hindi naman po, sir. Kaya lang
Hindi tama?
Hindi ho. Kasi ho, kailangan lang ho talagang mag-catch up plan po sa DOH. Kasi nga ho, marami na ho siya talagang backlogs.
Para bagang, ito kasi, uulitin ko lang, yung budget po ay authority to spend. The actual spending is an authority emanating from the budget. Ngayon, if they are not able to spend, I think you should fire, discipline the department concerned, not prejudice the public. You are saying we do not want this to happen, and therefore we deprive so that we will appear more efficient, like Secretary Duque, now that he can disburse 50 million in 2019, I'm sure he can disburse and he can obligate. Pag hindi mo pa na obligate na disburse yung 50 million in 2019, talagang, ito, if he disburses and obligates and disburses 50 million, he is efficient. Director Jane?
Yes, sir.
Yes, sir.
But that is only 50 million, sir. But that is only 50 million, sir. We're talking of the billion po ng HPEP.
No, I'm just talking about 2019. Yun lang po ang appropriation niya. And we're saying this is a matter of making them more efficient. Secretary Duque obligates and disburses in January of 2019. Before January 15, 2019, he obligates and disburses 50 million. So he is extremely efficient.
So yung 50 million po, ang intention po doon is for the monitoring po ng mga projects po, na yung mga backlogs, so para to enable DOH to make the catch-up plan po.
So absolutely, there is no appropriation for health facilities enhancement program. Zero talaga.
For monitoring po yung 50 million.
Monitoring lang. Aba. You spend 50 million for monitoring, but we cannot buy one X-ray machine, which we need under the Health Facilities Enhancement Program, because of the failure of the bureaucracy to obligate enough funds. Ganun ba yun? Presently? Is that how we do it? You know, my impression is that mukhang nag-window dressing tayo rito efficient tayo, ha? Because ito lang ang inappropriate natin, but nakakalimutan natin na ang ating namang objective dito ay ang programa natin, bigyan natin ng serbisyo ang ating mga kababayang mahihirap. Kung ganito pong ang ating patakaran, mukhang hindi po tayo makakarating dun sa ating ibig marating. So, okay, I'll repeat. Would the DBM, so that we will not keep on repeating this, because hindi ako titigil dito. Because I'm really convinced that this is wrong. Is the DBM willing to submit an errata for DOH before we continue deliberating on this?
Sir, we will raise it to our principal, sir. I am not in authority to say
You're not
yes
in
or no,
authority.
sir.
All right, I can understand you're not in authority. Are you willing to recommend as a DBM representative in this committee hearing?
Sir, I will have to raise this concern sa aming principal po, sir.
And so, when do we know the response and of the principal? Oh,
Sir, ang difficulty kasi namin, sir, talaga. Hindi ho kasi talaga nakakapag-submit si DOH. Kaya nahihirapan din ho kami on our part to make a recommendation.
ano po, let's assume without admitting na itong si Secretary Duque hindi nakapag-submit. Bakit mo paparusahan yung mga tao, ang ating mga pasyente sa mga ospital natin? Bakit? Why is that the response to the assuming inefficiency of Secretary Duque or Secretary XYZ in another department? Why are we punishing our people for such a situation which is even disputed? I do not see the logic.
Sir, kasi ho, kung wala ho kasi tayong listahan, at that time ho, sir, I'm not telling now ho, kasi ngayon ho, sinasabi ho, may listahan na po. At the time na ginagawa ho yung budget kasi ho, talagang ho, wala naman ho kasing ma-present sa amin na details. So, ano ho yung basis namin po to recommend kung wala naman ho kaming details na nire-receive po on the part of DOH?
Kaya nga, so the basis of the errata, Secretary Duque, will be what Secretary Duque will submit to you? Saan? Meron na ba?
Projects. Priority is one.
Will you submit it today? I mean, in this hearing now?
We can certainly.
You can submit
Mr.
it to
Chairman,
the
we can do
DBM
that.
and give us a copy.
Yes, Mr. Chairman.
And it should be an errata, not a budget suggested by the committee. Because that is subject to a veto. Ngayon, kung i-veto na rin yung kanilang recommendation, iba kung saan na yun, wala ka na talagang magawa. That is why. So, can you officially receive, Director Abelio, the errata that is being submitted or the request for an errata?
We can, sir, we can submit that request sa aming Department Legislative Office po na lang ho.
Sa
Dito ho, sa Senate, meron ho kaming DLO unit ho dito.
Bakit ba dadaan pa tayo sa ganong klaseng paraan? Nagkakaharapan na tayo rito eh.
Ipo-forward
On the record, we mark it Exhibit A. Secretary Duque submits Exhibit A to you. And in the next hearing, you tell us what the DBM will say. Pwede ba yun?
Sir, yung isasubmit naman ho ng DOH via our DLO will be submitted or forwarded directly ho sa Office of the Secretary namin.
Wait with you anymore. Just submit it, Secretary Duque, para hindi tayo magdebate dito.
This is supposedly the Exhibit A that you were referring to. It's already here.
Oh, yan, oh. So, ano gagawin niya rito? Huh?
Per hospital and per municipality basis. Ito na po.
Oh, yan pala, oh.
So this will be the putative Exhibit A.
That's in the amount of 30 billion total po. 16 billion muna.
16 billion muna.
The immediate.
And that is for the, in other words, 2019 will be how much?
16 billion.
16 billion.
Yes, sir.
As against the present current year of 30 billion.
30 billion,
Oh,
that's
sige, okay. That's understandable because these are capital outlays and etc. But there must be an authority to spend 16 billion by including this in the budget. That's what we're saying. So, all right, we just await, Mr. Chair. We should not close this hearing until, until we get a response from the DBM on this issue alone.
Yes, Assistant Director Abella, can you please facilitate already the transmittal, no? Because we have the minority leader and all, I guess all the centers here are very much concerned with the HFEP because we know how much this has really improved the health facilities. Tama si minority leader, ang hirap namang isiro natin because there are some that I have visited that are halfway finished. And we cannot afford that they will be they will not be used. All the more we are depriving our people, no, of health facilities that they should be using already by next year. My concern lang ako, tanong lang ako before my colleagues also, dun sa RA 10351 or the incremental revenues from the excise tax on alcohol and tobacco products, 20% of that, correct nyo, dapat allocated for health facilities enhancement program and medical assistance. So kung isisiro ho natin sila sa 2019, what would happen to that earmark in the annual tax law na talagang 20% dapat ho yan for the HFEP? Paano po yan? Iipunin na lang po natin kung sakaling paano po gagawin natin? Kasi earmark po yan eh.
Lang po siya, sir, kasi nga ho, kung talagang siya ay earmark for the HPEP, hindi ho natin siya pwedeng magamit ho sa iba.
At paano, kung isisiro nga nyo, paano gagamitin kung wala silang appropriation, how will be able to use kung wala silang appropriation for 2019?
Mr. Chair, hindi mo ba dapat automatic yun na yung 20% nilalagay niya na sa HREP? So technically, it shouldn't be zero. Dapat may 20% from the sin tax collections.
It should be automatically appropriated, but and the way to do it is to include it in the national expenditure program. It is obligatory, in other words, Nancy, it is obligatory that the DBM should include the sin tax allotment in the national expenditure program. In this particular case, it was not even included in the national expenditure program. That is a substantive law. What DBM is doing is to amend the substantive law by not including it in the national expenditure program.
And you have to comply, no, with the above mentioned provision. I guess, no, tama si Mentor Leader. That's yun po ang sinasabi ng batas. So you have to comply, no? Kailangan may automatic. Dapat kasama ko kagad automatic sa National Expenditure Program.
Siguro, Mr. Chair, magkano ho ba yung 20%? Yun na nga. Mr. Chair, can we ask DBM, how much is that 20%?
My apology po, wala po ako ngayong numero ho for the to determine the 20% po.
Siguro, can you just submit to the committee?
Yeah, at also ho, sir, i-raise ko na rin po yan sa aming principal together with the pinopropose po natin, yung dapat nung errata, yung sinasabi po nating errata ngayon ho.
Mr. Chairman, if I may also take this opportunity to also request for the reinstatement of the 8.3 billion for the human resource for health budget, which
We will go into that. We're just on the hindi pa po ako tapos. Isa pa lang. Sige.
Now we'll go into that. We're only in the health facilities program, and we will wait the assistant director. No, we'll wait for the response of DBM as soon as possible because we cannot close this budget briefing not unless we have already satisfied the concerns of the center's president, including the minority leader, and it's very important. So I hope that you can transmit as soon as possible the concerns, and we are expecting the feedback as well.
Yes, sir. We will elevate these concerns to our principal.
Otherwise, we will hold the budget of the DBM if you do not submit right away.
Wala naman si DOH dito. You have DBM on the one hand hitting you. Pag hindi natupad, kami naman magsasabing suspended dahil kulang ang perang binibigay sa inyo. Alaga naman. So, yes, can we go now to the human resource Health Human Resources?
Now we can now go to HRH, the concern of our minority leader. It's really valid though, because we have, as the Secretary said, it will affect 15,000 of our HRH workers or health resources for health, human resource for health.
Is it a correct statement that the reduction from the present level of 9.599 billion for the health human resources, HRH to 1.17 billion, what will happen to those who are presently in the payroll? Why? Firstly, why are we doing this? Why are we doing this? Why are we reducing the budget by about 8 billion? Bakit po?
Sir, yung kasing HRH po natin, ang majority po nun is MOE. So, ang MOE ho kasi, sinubject po natin siya sa utilization, sa performance po niya, utilization performance po. In the case of the HPEP, for the MOE ho niya, ang kanyang home performance in 2017 is only 76%. And then at the same time po, yung 2019 home level niya, we transferred 7.8 billion lang po, which is originally should be part of the DOH budget. Nilipat lang ho namin siya sa MPBF. In case ho, magkakaroon ho ng conversion na ho, from job order to contractual na ho. So, nandun pa rin naman ho, may 7.8 pa rin po tayo ng DOH, HRH, under nga lang ho sa MPBF po.
Mr. Chairman, ang problema ho dun kasi, inilipat nyo sa MPBF for a clear justification that the cost of the compensation of people who will be converted from job order to contractuals. Number one, you have to absorb their social security benefits. Okay. Number two, you have to implement. They will have to be included in the implementation of the Salary Standardization Law 2015 tranche 4 rates. So tataas yung cost mo. Pero having said that, kung hindi mo naman tataas yung budget mo, talagang mababawasan yung taong masuswelduhan natin. Assuming hindi mo idadagdagan yung budget. Pagka maintain natin yung 26, kasi yun right now, in 2018 budget, what we're able to pay for is 26,307 human resource for health. Pero nagkaroon nga ng...
How much, 26?
26,307 employees. With the 9.599 billion budget. 9.59 billion budget. Pero yun na nga, big portion of that, pumunta na nga ho sa MPBF, pero yung cost mo tataas nga di ba? So magbabawas ka talaga ng tao. So to compensate for that, we need to reinstate that 8.7 billion to bring back 15,012 plus yung 11,000 that the 6.4 billion will be used to pay for. Para we can maintain the 26,307 employees.
So,
Before we continue, the chair would like to acknowledge the presence of Senator Grace po.
so liwanagin lang natin, yung present 9.6, rounding it off,
Yes, sir.
9.6 billion for the human resources for health of the department enables us to hire 26,307 PACs.
Yes, sir.
Yes,
Yes, sir.
nurses.
For 2018, sir.
For 2018. When we're saying that we would want to move this from project, from
Job order.
from job order to
Contractual.
contractual.
Yes, sir.
It has to increase by, it will increase by how much? No, it's present is 9 billion. Maintain the 26,000 or so health workers and move them from job order to
Contractual.
contractual will mean how much more?
9 billion.
No, that 9 billion is present and they are They are 9 billion, you're saying presently they are job orders.
Well, all told, ganito lang po, Mr. Chairman,
Oo.
yung 26,307 employees, job order, assuming we're not moving them, assuming
Yes.
Job order lang pa rin sila ngayon. We're not going to upgrade
Yes.
them. Okay.
Oh.
Ang kailangan po natin is 9.6 billion.
The same budget.
Same budget.
Maintaining them as job orders
Yes, sir.
and maintaining exactly the same number.
Yes,
Now,
sir.
Step 2, you want to convert them from job order to casual.
Oh, magiging 11,000 na lang.
Magiging 11,000 na lang?
Oo.
Bakit?
Kasi syempre, yung cost mo per
Yes, naintindihan ko yan. Now, I think the opposite question is, if we maintain the 26,307 health personnel, which we need today,
Yes, sir.
and make them contractual, how much more budget do we need?
Well, the figure here is we'll need a total of 18.8 billion
Yan. So the difference between 18.8
and 9.
and
Is about
9.6,
8.7 mga ganun ho.
8.7 is what we need
Reinstate.
to maintain 26,307 health personnel as contractuals. Hindi po ba? That's what it means?
Yes, sir.
So why are we not doing that?
Meron na ho. Ang sabi ho ng DBM, the MPBF, they've essentially parked monies into the MPBF. And sabi nila that's just the floor, the 6.4 billion, but as soon as we submit, they can raise it. That's just the floor. We can still increase
What
it.
is the floor?
The floor is 6.4 billion.
6 point...
Yun po nakalagay sa kanilang DBM recommended figure of 6.442 billion. Na nakapark.
Alam nyo, Mr. Secretary, situate yourself as a nurse in some far-flung area. Can you imagine the tension that you go through? That you are not even sure that on January 1, you have a job. That affects your performance. And yet, these are all budgeting entries that we are playing around with. Transfer them to the MBPF, etc. You know, it's nice to debate on whether or not it should be in the budget of DOH or MBPF. But situate yourself in the place of this health personnel. And their morale affects the service that they do.
Sure.
And yet, wala namang diferensya eh. Ano ang diferensya? To provide them with a better security of tenure and a better package, we are prepared to put them on a casual basis instead of a contractual basis. Contractual basis. Instead of a job order. Why are we so hard on our people? This is not something, you can be hard on the pork barrel of legislators. But do not be hard do not play around with the livelihood of these people. These people have families ba? Nanginginig yan. Sa ngayon pa lang, marami nagre-reklamo, sumusulat sa amin. Sa akin, saying, what will happen to us on January 1, 2019, knowing this? Maybe part of the 15,000 that will have to go. So why can we not assure the 15,000 or so that they will stay and make a decision? Bakit ba naman? Why do you have to postpone a decision which we have to make anyway? What is the difference between making a decision now and making a decision in January when we will play God already? Because now we have to get the approval of DBM. I do not understand it. So, similarly, may I ask that an errata be submitted here? What are we doing here ba? Why are we, ang akin lang, ako ang just concerned, 15,000 personnel nandyan ngayon, unsure of whether or not they can eat on January 1, 2019 because of our desire to have a proper budgetary process. Hindi po tama sa akin yan, Secretary Duque. So, Madam Abelia, ano po ang gagawin natin? Hindi po ako papayag na I am a minority. But I will submit to my chairman that this kind of a situation cannot be tolerated. We cannot sacrifice. These are people who have been there, I know how many years already, Secretary Duque. Matatagal siguro ito, at least a year, 2 years, 3 years. Suddenly, may pamilya yan, mawawalan ng trabaho. Dahilan sa gusto natin ilagay sa MBPF, etc., etc., Jesus Christ. Naintindihan po ba yan nung doktor doon sa Sultan Kudarat?
Mr. Chairman, I'd like to agree with you 100%. These are people deployed to far-flung, geographically isolated, disadvantaged areas, and really destitute communities that really need this kind of basic health services, no, that these employees will be able to provide.
Mr. Chair, tsaka siguro to add to the point of the minority floor leader, maapektuhan din ho yung quality of service na ibinibigay natin dun sa mga constituents natin.
And likewise, that's very essential in our what we are setting up as the service delivery network. These are the primary care. Ito po yung mga foot soldiers and the ones really in the front line. So, I guess all of the centers here present are also concerned on. We would like to support on the. We want to make sure that by 2019 they will still be on the job because they are really providing primary care service to our constituents.
Mr. Chairman, also to underscore the fact that this administration actually pushes for universal health care, and human resource is a major pillar of universal health care. So the direction to pursue is to add rather than to deduct.
Mr. Chair, siguro since nabanggit yung huyan Secretary, hindi ho ba nakaprogram for 2019 na magdagdag pa nga kayo ng health workers for primary health care?
Budget-wise, kailangan magdagdag. Assuming isi-shift mo sila to...
Hindi, kasi di ba you have 26,300 employees. Wala ho ba, hindi ho ba nakaprogram for 2019 na dagdagan pa tong numero na to?
Kasi ho, ma'am, madali ho dagdagan. But we also have to balance this with the infrastructure, with, you know, putting up more barangay health stations and rural health centers, district hospitals, provincial hospitals. So the human resource is an imperative, but it is anchored on the expansion of the health facility infrastructure. So binabalanse po natin kasi mahirap naman mag-hire tayong marami, wala naman tayong paglalagyan. So kailangan po mutually adjusted po yung dalawa.
Pero kasi Secretary, di ba, may catch-up mode nga kayo. So technically, dapat ma-fast track yung mga infrastructure nyo. So kasabay din doon dapat yung staffing requirements nung matatapos ng infrastructure project.
Na-consider na po ito sa ating staffing pattern.
So kasama na po din sa 26,300.
Yes, ma'am. Kasama na po pati yung mga sa pharmacies natin, kasama na po dental hygienist, the whole slew of, the whole gamut of health professionals po.
Thank you, Mr. Chair.
Yes, Senator Lisa Tiveros.
Thank you, Mr. Chair. Still on the proposed submission of errata by the minority leader. Of course, we're hoping for the best here. Gaya ng sinabi ni Chairman, all of us here present are supporting that and hoping for a positive response from the DBM. But just for worst case scenario, supposing the DBM refuses to issue that errata. So, my sense, with all due respect, Mr. Chair, my sense is that the Senate, through this subcommittee and the Committee of Finance, take a stand by committing to make the appropriate restoration of the budget for HFEP and HHRD, with or without the errata. That's our plan A, that's our best scenario. But feeling that na gagawa tayo ng paraan na magkaroon ng sapat na budget ang DBM para sa HFEP at saka para sa human resources. Mr. Chair, I submit.
Thank you. Our minority leader, Mr. Cagday.
Yes, that's a good idea, but we must get a commitment from the DBM that they will not recommend a veto, a line item veto. Otherwise, it's useless to rearrange to supplement the budget of DOH, get it from other items in the budget. Dito, hindi mo na maibalik yun. So, I am in favor of that. I endorse that process if errata cannot be issued, with the DBM's commitment that we will not recommend a veto on this item. Because otherwise, it's a useless exercise. Magpapakahirap si Senator JV maghanap ng source ng how much is, whatever is the budget necessary. He will crack his head, makikipag-away sa ibang departamento para lang mapunuan ang budget ng health. Pagdating ng panahon, ibibito ng presidente dahil wala sa National Expenditure Program. So mabawasan mo yung budget ng isang ahensya, hindi mo naman maibigay sa DOH sa inabito. So unless the DBM goes on record that the readjustment that will be recommended by the committee will be approved, I think we are raising hopes, vain hopes, if we do through that process. What is to me more, first, if we can have the errata, if we cannot have the errata amendment, but accompanied by a commitment on the record that the DBM will not recommend will not recommend a veto and will in fact endorse this amendment to the budget. Thank you, Mr. Chair.
Thank you, our minority leader. I share the same position. The chair shares the same position that we can sacrifice all the other departments, but not health, not education. No, these are requisites of good governance, lalo na especially health. Tama si Senator Dillon. Ang daming pork barrel dyan di ba? Nakakalusot dapat ito tapos ito very much needed and for the implementation of primary health care. This should be supported, in fact, no? We cannot afford to sacrifice 15,000 of our workers, especially that we are about to pass already the universal health care. This will be very essential in the success of providing quality health care to our constituents. No? So, be rest assured that I think it's multi-party kami rito. You can see two from the minority and two from the majority are working hand in hand to support the budget of the Department of Health to ensure that the programs are carried out. No? So that's the beauty of the Senate. We always cross party lines for the good of for the good of the service of the people. No? So especially on health. No? I think we can sacrifice the other departments, but not on health. Senator Tiberos, yes.
Huling dagdag lang, Mr. Chair, dahil napag-uusapan na rin natin yung Health Human Resources. When the Chair calls for a continuation of the hearing, isama rin po natin sa attention natin yung barangay health workers. Kasama po sa pillar na iyan ang universal healthcare and kasama po sa concern naming lahat ng mga senador dito in terms of not defunding but fully funding DOH's budget for its human resources. Salamat, Mr. Chair.
Thank you, Senator Tiberos. Anyway, today we will have a caucus right now, a majority caucus, and we will also talk about some things regarding the budget as well. We will suspend for now for lunch break. We will come back around 1:30, but we would like to have already word from that will be good. But there are other concerns that we would want to take up, but for sure, we will have one more hearing, no, regarding DOH. We will just announce it later, but I hope the chair would like to resume later session so that the other concerns will already be taken up para matapos na, para at least when you come back next time, siguro by that time, from the minority leader, from the DBM, hopefully by that time we will already have word from the DBM, no? Okay? Because this all depends on that, Now before we would want to approve the budget of DOH, we need the word already from the DBM by that time, okay? Ma'am, siguro next year, probably by next week, no? no? Ms. Benedi, I hope that you can already transmit to the Secretary on your principal concerns of the minority leader and other senators.
Yes, sir. We will raise immediately this concern.
So with that, we will now...
Mr. Chair?
Yes,
Before
Secretary
we
Binay.
suspend, out of curiosity lang, Secretary Duque, how much did you ask for during your budget call?
1 billion all in all.
Ano?
170, magkano ba huminga?
During your budget call, how much?
171
It's
including
171 billion.
So, ang natira yung 71 na wala yung 100.
No. For OSEC lang. For OSEC.
Yeah, for the DOH budget.
Which includes even PhilHealth. So that
Lahat
the
ho.
universe
Yeah.
budget,
Because
universal
the,
budget.
di ba ho, no 2018 you got 107?
Yes.
So for 2019, what was your budget during your budget call?
106 billion without PhilHealth.
With PhilHealth,
171 billion.
171. Okay. Thank you, Mr. Chair.
Yung PhilHealth naman hindi man nagalaw yun eh. Okay lang po yun.
Anyway, again, with suspend for lunch break, and we'll be back around 1 to 1:30, so that we can already 1:30 na po, no? So that we can already tackle all the other concerns, no? While we await then sa second hearing, we'll announce also when the next hearing will be. Because big departments usually take about we have about 2 hearings. Okay, so now session is suspended. Before Senator, can you settle down for a while? Can you settle down before we go on break? Since Senator Grace for already here, just some concerns lang. So before we still have time naman. It's still early.
Okay.
Before we resume session again. Senator Grace, have the, please settle down so that we can hear each other. Wala pa naman yung alas 12, malapit na. So,
Okay.
hintayin na lang natin.
Mr. Chair, maraming salamat po for your consideration. Magandang hapon po sa, tanghali, almost, sa inyong lahat. Alam nyo, Secretary, good morning. Recently, we have this, at least it was approved in the bicameral conference, nagkaroon tayo nung pagpasa nitong first 1,000 days of a child's life. Meron na ba kayong allotment dyan just in case na ito'y matutuloy or initial programs in the past? Although it's not really been signed into law, I expect it to be.
Mr. Chairman, may I request the head of the DPCB, OIC USEC, Mirna Kabutahe, to please respond to the query.
Thank you, sir. Thank you, madam. The total budget for family health, nutrition, and responsible parenting, of which the first 1,000 days is included, has 2 budgets. One is the public health management, where we have the operations and the commodities which are specific for vitamin A, for micronutrients and other medicines. This is as far as the Department of Health. We have another budget from the National Nutrition Council. For the National Nutrition Council, we have 118,322,000 pesos for 2019. But then we will have to break down, because this family health, nutrition, and responsible parenting is really an integrated approach for various life stages from birth up to aging.
Okay, actually, thank you for giving us a rundown of that one. I expect that hopefully next year to increase when this is actually a law already. But my other concern is, when it comes to the budget of the DOH, which I understand was cut by around 35 billion, am I correct? That you
100 billion, the proposed budget.
the proposed budget cut by 100 billion. Okay, I heard, and this might have
30
been asked.
billion for HPAP. 36 billion.
36
sorry.
billion. Okay, I've heard I'm not sure if this has been asked. Totoo ba na magka-cut ng jobs ng mga nurses? 6,000 nurses?
15,000. No, it was discussed here.
All health professionals, Mr. Chairman, will be affected. So from doctors, nurses, from pharmacists, midwives, medtechs.
Yan yung talagang kailangan natin, di ba?
Yun ang kailangan natin for universal health care.
So you are actually for the, okay. How about the mental health initiatives of the DOH? Magkano yung budget nyo? Kasi napasa na rin yan. Ito also through the strong push of Senator Risa. But magkano at paano yan i-implement?
Again, Mr. Chairman, with your permission, OIC USEC Kabutahe, please.
Thank you, ma'am. Thank you, sir. The National Mental Health Program, again, is part of a bigger program which we call the Prevention and Control of Non-Communicable Diseases. Also, again, we have two portions of the budget. One is operations, and one are the commodities. Specific for the National Mental Health Program, for operations, we have 35 million budgeted for 2019, 35,912,640, and for commodities, we have 71 million
Pag
allotted.
sinabi ninyong commodities, mga gamot ito.
Yes, ma'am. Pwede yung mga, commodities.
Like what
includes
medicine?
Supplies, both medicines and supplies.
Can you give me an example of medicines that you distribute for mental health?
Mga biperidine, saan na ba yan? Our chlorpromazine, lithium, carbamazepine, valproate, haloperidol, risperidone. Ito yung mga for antipsychotics. These are psychosocial
Let's say
medicines.
depression.
Depression is central depression.
Kasi syempre may psychosis, talagang yun yung immediate, no? Pero yung underlying problems nandito sa depression, maraming kasi mga kabataan ngayon ang nagkakaroon na ng issue dito sa depression pagka, at it's still a taboo issue for some, and especially for the lower class, they don't really think it's an illness, but it is. So for depression, what drugs do you prescribe?
We have sertraline 50 milligrams per tablet, ma'am. This is 30 tablets for 12 months for the medicine requirement for the patients.
So
that
you give those?
Yes, we are going to give them.
And all public hospitals will be able to have access to this, or?
We have medicine access sites because they have to be trained, but we want to increase our number of access sites.
Okay, I think that will be all. I know that everybody's gearing up for lunch. If there are any additional questions, perhaps at 1:30 if there's still time. But that's it. Thank you, Mr. Chair. I appreciate the accommodation.
Thank you, Senator Grace. Anyway, if you still have concerns, we will resume again later at 1:30 to continue. Yes, Senator Risa.
Mr. Chair, just to put on record that I'll also be asking additional questions about mental health, both from, it's so nice to call her Yusek Mirna because all the past 3 decades manang Mirna, mula nung magkatrabaho kami sa Cordillera People's Forum at Coalition for Peace sa Cordi. Questions to Yusek Mirna at kay EVP COO John din sa PhilHealth tungkol sa mental health. Salamat po, Mr. Chair.
Hey, thank you, Senator Risa. Since there are no more concerns for this morning, we'll see you at 1:30. Session is suspended. Thank you.
Excuse me, everyone. Can I have your attention, please? The chairman, Senator J.V. Ejercito, just called me up and then had informed me that it's no longer necessary to have a hearing at 1:30. So you can all just go back to your place of work, and we'll just await for further advice from the Senate. Thank you. Ethical